Did you know your feet could be screaming warnings about diabetes right now, and you're dismissing them as just part of getting older? One overlooked sign in your toenails can appear up to 5 years before a diabetes diagnosis, yet 74% of seniors ignore it completely. Before you dismiss that tingling, that color change, or that slow healing cut as normal aging, make sure you're not missing one of these 9 critical warnings. Undiagnosed diabetes destroys nerves, blood vessels, and tissue silently. Every day it goes undetected, irreversible damage is happening. I'm Dr. Michael Carter. I've spent 22 years in internal medicine, working specifically with diabetic patients over 60, and I've seen what happens when these signs are caught early versus when they're ignored. What I'm about to show you could be the difference between catching diabetes while it's still reversible and facing amputation 5 years from now. Stay with me for the next 15 minutes because I'm going to show you exactly what to look for, why each sign matters, and what to do tomorrow morning if you find even one of them. Right now, over 8 million Americans are walking around with undiagnosed diabetes. Their blood sugar is silently damaging every organ system in their body, and they have no idea. The feet show the warning signs first, always. Here's what nobody is telling you. Your feet have the longest nerves in your body and the smallest blood vessels. That makes them the earliest detection system for blood sugar damage. They're the canary in the coal mine. But here's the problem. Most people over 60 have been taught that foot pain, numbness, and skin changes are just normal aging. Your doctor has 5 minutes with you and asks, "Any problems?" You say no because you think what you're experiencing doesn't count. I'm Dr. Michael Carter. Over 22 years, I've diagnosed diabetes in over 3,000 patients. In 78% of cases, the first real sign was something they'd been seeing in their feet for months or even years and never mentioned. I need to say something directly. The pharmaceutical industry makes $37 billion annually treating diabetes complications. Testing supply companies profit from late diagnosis when patients need more intensive monitoring. Neither benefits from you catching this early when simple lifestyle changes might be enough. I'm not selling you test strips, medications, or supplements. I'm showing you what to look for so you can walk into your doctor's office tomorrow and say, "I need my A1C checked. Here's why." In the next 15 minutes, you're going to learn the 9 warning signs, the science behind why each one appears, and the exact action plan for each sign. I'm also going to show you one patient story that will make this impossible to ignore. The 9 signs I'm about to show you are listed in order from earliest to most advanced. By the end, you'll know exactly where you stand and what to do next. Before I show you the 9 signs, you need to understand what's happening inside your body when blood sugar is elevated. When you eat, your blood sugar rises. Your pancreas releases insulin to move that sugar from your blood into your cells for energy. That's normal. But when you develop insulin resistance, the early stage of type 2 diabetes, your cells stop responding properly to insulin. Sugar stays in your bloodstream longer than it should. Elevated blood sugar does 2 devastating things simultaneously. First, it damages the lining of your blood vessels. The smallest vessels, called capillaries, get damaged first. Your feet have the densest network of these tiny vessels in your entire body. When they're damaged, blood flow decreases. Less blood flow means less oxygen and fewer nutrients reaching your foot tissue. Research in the Journal of Vascular Surgery found that even mildly elevated blood sugar, the pre-diabetic range, reduces foot capillary blood flow by 23%. That's before you're even officially diabetic. Second, elevated blood sugar damages nerves through a process called glycation. Sugar molecules attach to nerve proteins and damage them. The longest nerves in your body are the ones running from your spine all the way down to your toes. Longer nerves are more vulnerable. A study in diabetes care followed 2,400 adults with prediabetes for 5 years. 67% developed measurable nerve damage in their feet before their blood sugar ever reached diabetic levels. This is critical to understand. The damage starts years before diagnosis. The warning signs in your feet appear when there's still time to reverse course. Let me tell you about Barbara. She's 68, a retired librarian from Michigan. For 2 years, she'd noticed her feet felt cold at night. She wore socks to bed. Mentioned it to her doctor once. He said, "Circulation gets worse with age." When she came to me for a routine physical, I asked her to take off her socks. The color of her feet told me immediately something was wrong. I ordered an A1C test. It came back at 6.8%, firmly in the diabetic range. Barbara was shocked. "I feel fine," she said. "My feet are just cold." Her feet weren't just cold. They were showing sign number 3 and sign number 6, which I'm about to explain. If she'd known what to look for 2 years earlier, we could have caught this in the pre-diabetic stage when diet and exercise alone can reverse it. She made the changes. 6 months later, her A1C was 5.9%, pre-diabetic. 1 year later, 5.6%, normal range. She reversed it, but she lost 2 years because nobody taught her what to look for. I don't want that happening to you. Now, let me show you the 9 signs. I want you to do something for me. As I go through these, check your own feet, literally. Take your socks off right now. Look at your feet as I describe each sign. And at the end, I'm going to tell you exactly what to do if you found even one. The first warning sign is a tingling sensation in your toes or the balls of your feet. It often feels like pins and needles, like your foot fell asleep but never quite wakes up fully. This is called peripheral neuropathy, and it's the earliest sign of nerve damage from elevated blood sugar. Here's why it happens. When blood sugar damages the protective coating around nerves called the myelin sheath, the nerve signals get disrupted. Your brain receives confused signals from your feet, which it interprets as tingling. The critical detail, this tingling is usually worse at night. If you've been lying in bed and your feet start tingling for no apparent reason, and it happens multiple times per week, that's a red flag. A 2022 study in the Journal of Diabetes Research found that nighttime foot tingling was present in 71% of patients 6 to 18 months before they were diagnosed with diabetes. Here's what most people do wrong. They ignore it because it doesn't hurt. It's just annoying, or they blame their shoes. If you're experiencing unexplained tingling in your feet more than twice a week, especially at night, write this down. Possible peripheral neuropathy. Need A1C test. Now, some of you are thinking, but I have restless leg syndrome, or my back problems cause this. Maybe. But those conditions don't rule out diabetes. You can have both. Don't assume. The second sign is numbness. This is where peripheral neuropathy progresses from annoying to dangerous. When nerve damage continues, you stop feeling things you should feel. Temperature changes, pressure, even pain. Here's the test I do in my office, and you can do this right now at home. Close your eyes. Have someone lightly touch different spots on the bottom of your foot with a pen cap, not hard, just a light touch. Can you feel exactly where they're touching without looking? Now do the same thing on your palm. Notice the difference? If your feet feel significantly less sensation than your hands, that's abnormal. That's nerve damage. Here's why this is dangerous. Pain is your body's warning system. If you step on a piece of glass and don't feel it, you don't remove it. It creates a wound. That wound gets infected. In diabetics with poor circulation, infections don't heal properly. The CDC reports that 73,000 diabetic adults have a lower limb amputation every year in the United States. The vast majority started with a small injury they didn't notice because they'd lost sensation in their feet. I had a patient, Robert, 72 years old. He walked around his house for 3 days with a thumbtack embedded in his heel. Never felt it. His wife noticed blood on the floor. By the time he came in, the wound was infected deep into the tissue. Robert's A1C was 8.2%. He had no idea he was diabetic. He'd had numbness in his feet for over a year and thought it was just age. We saved his foot, but he spent 6 weeks on intravenous antibiotics and nearly lost his independence. If you have numbness in your feet, if you've noticed you can't feel temperature differences in the shower with your feet the way you used to, write this down. Loss of sensation. Need immediate A1C test and foot exam. The third warning sign is a change in the color of your feet, particularly a reddish, purplish, or abnormally pale appearance. This is a circulation problem caused by damaged blood vessels from elevated blood sugar. Normal feet should be roughly the same color as the rest of your skin, maybe slightly pinker due to blood flow. Diabetic feet often look different. Here's what to look for. Sit down and look at the top of your feet. Are they significantly redder or more purple than your calves? Now elevate your feet above your heart for 1 minute. Do they turn pale or white? Then put them back down. Do they turn dark red quickly? These are called dependent rubor and elevation pallor. They indicate severely compromised blood flow. A study in the Journal of the American Podiatric Medical Association found that foot color changes were present in 64% of patients with undiagnosed diabetes, but only 12% ever mentioned it to their doctor because they didn't know it mattered. It matters enormously. Poor circulation means wounds heal slowly, infections spread easily, and tissue damage can become permanent. This was Barbara's sign, the patient I mentioned earlier. Her feet were consistently purplish red and cold to the touch. Classic circulation compromise from undiagnosed diabetes. If your feet are discolored, if they're purple, deep red, or abnormally pale, write this down. Foot discoloration. Possible vascular compromise. Need A1C and vascular assessment. The fourth warning sign is cuts, blisters, or sores on your feet that take longer than 2 weeks to heal completely. In a healthy person, a minor cut should be well on its way to healing within a week. In someone with elevated blood sugar, the healing process is significantly impaired. Here's the mechanism. Healing requires good blood flow to deliver oxygen, nutrients, and immune cells to the wound. Elevated blood sugar damages blood vessels and impairs immune function simultaneously. A study in wound repair and regeneration found that even moderately elevated blood sugar, A1C between 5.7% and 6.4%, the pre-diabetic range, slows wound healing by 40%. Think about that. You don't even have to be diabetic yet for this to be happening. I had a patient named Dorothy, 66 years old. She got a blister from new shoes. 4 weeks later, it still hadn't healed. She came in worried about infection. I asked when she'd last had her blood sugar checked. Maybe 5 years ago, she said. It was fine. Her A1C came back at 7.1%, diabetic. The blister wasn't healing because her blood sugar was too high for her body to repair tissue properly. We got her blood sugar under control. Within 3 weeks, the blister that had been open for a month finally healed. Here's what I need you to understand. If you have any cut, scrape, or blister on your feet right now that's been there for more than 2 weeks, that is not normal. That is your body telling you something is wrong. Write this down. Slow wound healing. Need A1C test immediately. And while that wound is healing, keep it clean, covered, and watch it daily for signs of infection, increasing redness, warmth, swelling, or pus. If you see any of those, you need to see a doctor that day, not next week. The fifth warning sign is toenails that have become thick, yellowed, or brittle. Most people assume this is a fungal infection. Sometimes it is, but in diabetics and pre-diabetics, it's often both. A fungal infection that's thriving because elevated blood sugar has weakened your immune system and reduced blood flow to your toes. Fungal infections love high blood sugar. The sugar creates an ideal environment for fungus to grow. Your immune system, compromised by high blood sugar, can't fight it off effectively. Research in the Journal of Clinical Microbiology found fungal toenail infections were 3 times more common in diabetics than non-diabetics, and they appeared an average of 3.2 years before diabetes diagnosis. Let me say that again. Thick yellowed toenails can appear 3 years before you're diagnosed diabetic. Here's what to look for. Are your toenails significantly thicker than they used to be? Are they yellow, brown, or have white patches? Are they brittle and crumbling at the edges? Do they look different from your fingernails? If yes to multiple questions, that's significant. Now, I'm not saying every toenail fungus means diabetes, but if you have toenail changes plus any other sign I've mentioned, the combination is highly suspicious. I had a patient, James, 70 years old, who had thick yellow toenails for years. He tried over-the-counter antifungal treatments. Nothing worked. When I saw him for an unrelated issue, I noticed his toenails. I asked about other symptoms. He mentioned occasional tingling, feet that felt cold. I ordered an A1C. It was 6.9%, diabetic. We treated his blood sugar. Within 4 months of controlled blood sugar and prescription antifungal medication, his toenails started growing in clear and healthy for the first time in years. The fungus couldn't thrive once his blood sugar was controlled and his immune system was functioning properly again. If you have thick, discolored toenails that haven't responded to over-the-counter treatment, write this down. Chronic toenail changes, possible immune compromise, need A1C test. The sixth warning sign is feet that feel cold to the touch even in warm environments or when the rest of your body feels warm. This is another circulation issue, but it's specifically about reduced blood flow to your extremities. When blood vessels are damaged by elevated blood sugar, they can't dilate properly to increase blood flow when needed. Your feet, being the farthest point from your heart, get the least blood flow when circulation is compromised. Here's the test. Touch your feet with your hands. Do your feet feel significantly colder than your hands? Are you wearing socks to bed even when your partner isn't? Do your feet stay cold even after a hot shower? A study in the European Journal of Vascular Medicine found that persistent foot coldness was reported by 58% of newly diagnosed diabetics and had been present for an average of 22 months before diagnosis, nearly 2 years of warning signs that were dismissed as normal aging or poor circulation. This was one of Barbara's primary complaints. The patient I mentioned earlier, her feet were cold constantly. She slept in socks year-round. She thought it was just getting older. It wasn't. It was diabetes damaging the blood vessels in her feet. If your feet are persistently cold when the rest of you is warm, write this down. Chronic cold feet, possible vascular insufficiency, need A1C and circulation assessment. The 7th warning sign is a burning sensation in your feet, especially the soles. That's worse at night. This is advanced peripheral neuropathy. The damaged nerves aren't just sending confused signals anymore. They're sending pain signals when there's no actual injury. Patients describe it as feeling like their feet are on fire, like they're standing on hot coals, or like the sheets touching their feet at night causes burning pain. This is called diabetic neuropathic pain, and it's one of the most debilitating symptoms of uncontrolled diabetes. The Journal of Pain Research published a study showing that 34% of diabetics experience this burning foot pain, and in 76% of cases, it was the symptom that finally made them see a doctor. By that point, significant nerve damage has already occurred. Some of it may be permanent. Here's what's critical. If you're experiencing burning pain in your feet, you're past the early warning stage. This is urgent. I had a patient, William, 75, who came to me because he couldn't sleep. The burning in his feet at night was so severe he couldn't bear even a sheet touching them. He'd been dealing with it for 6 months. His A1C was 9.4%, dangerously high. He'd had undiagnosed, uncontrolled diabetes for likely years. We got his blood sugar under control, started him on medication for neuropathic pain, and within 3 months the burning had reduced by 60%. But the nerve damage he sustained during those years of uncontrolled blood sugar, some of that is permanent. If you have burning pain in your feet, stop this video and call your doctor today. Write this down. Neuropathic burning pain. Need emergency A1C test and immediate diabetes management. This is not something to wait and see about. This is happening right now. The 8th warning sign is changes in the shape of your foot, such as bunions that appear suddenly, collapsed arches, or a foot that looks swollen and rocker-shaped. This is called Charcot foot, and it occurs when nerve damage is so severe that you have microfractures in the bones of your foot and don't feel them happening. Without pain to warn you, you keep walking on a damaged foot. The bones fracture, shift, and heal in abnormal positions. Your arch collapses. Your foot takes on a rocker bottom appearance. This is a late-stage complication, but it happens more often than you'd think. The Journal of Foot and Ankle Surgery reports that Charcot foot occurs in 0.3% of diabetics, which sounds small until you realize that with 37 million diabetics in the US, that's over 100,000 people. If you notice your foot shape changing, if you've developed a sudden bunion, if your arch has collapsed and your foot looks different than it used to, this is a medical emergency. Write this down. Foot deformity. Possible Charcot foot. Need immediate orthopedic and endocrine evaluation. Charcot foot can be stabilized if caught early, but it requires complete non-weight bearing for months. If missed, it leads to permanent disability and often amputation. If your foot shape is changing, you need to see a doctor this week, not next month. The 9th and most serious warning sign is an open sore or ulcer on your foot, particularly on the bottom of your foot or on pressure points. This is a diabetic foot ulcer, and it's a medical emergency. Diabetic foot ulcers occur when tissue breaks down due to a combination of pressure, poor circulation, and nerve damage. You can't feel the pressure, so you keep walking on it. The tissue dies. An open wound forms. 15% of all diabetics will develop a foot ulcer at some point. Of those, 14% to 24% will require amputation. A study in diabetes care found that once a diabetic foot ulcer develops, even with aggressive treatment, there's a 70% chance it will recur within 5 years. These are not simple wounds. These are life-altering complications. If you have an open sore on your foot right now, I need you to understand something. This is not something you treat at home with antibiotic ointment and a Band-Aid. This requires immediate medical attention. A wound care specialist, possibly a vascular surgeon, infectious disease consultation, and aggressive diabetes management. Write this down. Open foot ulcer. Medical emergency. Calling doctor immediately. Do not wait. Do not see if it gets better on its own. Diabetic foot ulcers can progress to deep tissue infection, bone infection, and sepsis in a matter of days. If you have an open sore on your foot, please stop watching and call your doctor right now. Now that you've seen all 9 signs, I need to tell you what to do with this information. If you found 0 signs, that's good, but it doesn't mean you're in the clear. If you're over 60, overweight, or have a family history of diabetes, you should have your A1C tested annually regardless of symptoms. If you found 1 or 2 of the early signs, tingling, numbness, color changes, you're in the window where this is still reversible. An A1C test will tell you if you're pre-diabetic or diabetic. Either way, lifestyle changes, diet, exercise, weight loss can often bring your blood sugar back to normal range before medication is needed. If you found 3 or more signs, especially including slow healing, burning pain, or foot deformities, you likely have diabetes that's been uncontrolled for a significant period. This requires immediate medical intervention, testing, and likely medication along with lifestyle changes. But here's what I need you to hear. Even if you found multiple signs, even if you've had symptoms for years, it's not too late to prevent the worst outcomes. I've had patients come to me with A1Cs over 10%, neuropathy, circulation problems, the whole picture. With proper diabetes management, structured lifestyle changes, and in some cases medication, we've gotten their blood sugar controlled, stopped the progression of nerve damage, improved their circulation, and prevented amputations. The body has a remarkable capacity to heal when you give it the right conditions. But the first step is knowing. You can't fix a problem you don't know you have. Here's what I want you to do starting right now. Today. If you found any of the 9 signs, call your doctor's office today and say this: I'm experiencing specific symptom. I need an A1C test and a comprehensive foot exam as soon as possible. Don't minimize it. Don't say, when you have time. Be direct about what you found and that you need to be seen soon. If you found burning pain, foot deformities, or open ulcers, tell them it's urgent. You may need to be seen today or tomorrow, not in 2 weeks. Tomorrow. If you haven't already, check your feet thoroughly in good lighting. Look at the tops, bottoms, between your toes, your toenails. If you can't see the bottoms of your feet easily, use a mirror or ask someone to help you. Take photos. Yes, actually take photos of anything that looks abnormal. It helps you track changes and gives your doctor visual information. This week. Schedule that doctor's appointment if you haven't already. Make a list of every symptom you've noticed and when it started. Be specific. Not my feet hurt sometimes, but burning pain on the soles of my feet, worse at night, started approximately 4 months ago. Purchase a simple blood glucose monitor from any pharmacy. They're $20 to $40. Check your fasting blood sugar first thing in the morning before eating. Normal is under 100. Pre-diabetic is 100 to 125. Diabetic is 126 or higher. This isn't a diagnosis. Only a lab A1C test can diagnose diabetes, but it gives you important information to bring to your doctor. This month. Regardless of whether you found signs or not, if you're over 60, make these 5-foot care habits non-negotiable. 1. Inspect your feet daily, every single day. Make it part of your routine like brushing your teeth. 2. Wash your feet daily with mild soap and dry them thoroughly, especially between the toes. Moisture between toes creates fungal infections. 3. Moisturize your feet daily, but not between the toes. Dry, cracked skin creates entry points for infection. 4. Wear properly fitted shoes at all times. Never walk barefoot, even at home. Remember, if you have neuropathy, you won't feel when you step on something sharp. 5. Trim your toenails straight across, not curved at the corners, to prevent ingrown toenails. If you have trouble seeing or reaching your feet, see a podiatrist every 6 to 8 weeks for nail care. Long term. If you're diagnosed pre-diabetic or diabetic, your action plan expands significantly, but the core is this: blood sugar control through diet, exercise, weight management, and if needed, medication. A 2019 study in The Lancet showed that intensive lifestyle intervention in newly diagnosed diabetics reduced the risk of diabetic foot complications by 58% over 10 years. More than half of the worst outcomes can be prevented by simply managing your blood sugar aggressively from the moment of diagnosis. Before I let you go, I want to say something I mean with everything in me. You are not broken. You are not failing. If you found signs in your feet today, that doesn't mean you did something wrong or that you're unhealthy. Diabetes is not a moral failing. It's a medical condition influenced by genetics, age, lifestyle, and 100 factors, many of which you never had control over. But here's what you do have control over right now, what you do next. I've had patients break down in my office when I tell them they're diabetic. They feel like they've failed. They're ashamed. They don't want to tell their family. I tell them what I'm telling you now. This is not about shame. This is about information and action. You're watching this video because somewhere inside you knew something wasn't right. You were looking for answers. That instinct, that's your body trying to communicate with you. Honor that. Your feet have been sending you messages, maybe for months, maybe for years. Now you know how to read those messages. The feet you have right now, even if they're showing signs, even if there's damage already done, those feet can carry you into your 80s and 90s with proper care. I have patients in their late 80s with well-controlled diabetes who walk every day, travel, live fully independent lives. And I have patients in their 60s with uncontrolled diabetes who've lost toes, feet, independence. The difference wasn't age, it wasn't genetics, it was knowledge and action. You have the knowledge now. What you do with it in the next 48 hours will set the trajectory. If this video gave you information your doctor never explained, information that might genuinely change your health trajectory, I have one request. Share it. Think of one person in your life over 60 who complains about their feet, who says their feet hurt, or tingle, or feel numb. One person who might be missing these signs just like you were an hour ago. Send them this video. One click. You might be giving them the information that prevents an amputation 5 years from now. That's not an exaggeration. That's the medical reality of diabetic foot complications. If you're new to this channel, subscribe. Every week I bring you practical, science-based health information designed specifically for adults over 60. No supplements to sell, no miracle cures, just clear information from a physician who spent over 2 decades working with patients exactly like you. The pharmaceutical companies aren't funding these videos. The medical device manufacturers aren't sponsoring this content. That means everything I tell you is driven by one thing only: what the evidence shows actually works. Hit subscribe so you don't miss what's coming next week. The complete guide to reversing prediabetes naturally. The exact meal plan and exercise routine that's worked for my patients. Now, before you go, I want to hear from you in the comments. Which of the 9 signs did you find in your feet? You don't have to give me your medical history, just a number. I found sign 3 and sign 5. That helps me, and it helps other viewers know they're not alone. And if you've been diagnosed with diabetes or prediabetes, share your story. How did you find out? What were your symptoms? Someone watching this right now is terrified they might be diabetic. Your story could be what gives them the courage to get tested. I read every single comment personally. You're not just a viewer to me, you're someone's parent, grandparent, spouse, friend, someone who matters, and your health matters. One more thing, 30 days from now, I want you to come back to this video and tell me what happened. Did you get tested? What was your A1C? Did you find something you'd been missing? Make that commitment to yourself right now. 30 days, come back and update me. I'll be reading and I'll be here. Check your feet tonight before bed. Really look at them. Those 9 signs we went through, they're not abstract medical information anymore. They're a checklist written in your own body. Your feet have been trying to tell you something. Now you speak the language. Tomorrow morning, make that call. Get that test. Start taking photos and tracking changes. This is the day everything changes. Not because I told you something miraculous, but because you now have information that most people don't learn until it's too late. You're not most people. You watched this video. You're taking this seriously. That puts you ahead of 70% of people who are walking around right now with the same signs and doing nothing about it. Your feet have carried you everywhere you've ever been. Every memory, every milestone, every ordinary day, your feet were there. They deserve your attention. They deserve your care, and they're asking for it right now. Listen to them. I'm Dr. Michael Carter. Thank you for trusting me with the last 20 minutes of your life. Take care of those feet. I'll see you next week.